Good afternoon. Welcome to day 355 at the EMA office, where we'll be bringing you the latest in the COVID numbers. Joined here with Chairman Mark Kern. Every day, sir, it's Groundhog Day.
It is.
And Brian Whitaker. Brian, you have the numbers today.
Yes, sir. So in St. Clair County, they've tested 288,288, which is an increase of 935. For positive test results, they've received 28,165. That's 53 new since yesterday, and those are males and females under the age of 1 up to their 80s. That brings our daily county positivity to 5.7%. For negative test results, we're at 260,123. Unfortunately, they are announcing 3 new additional COVID-related deaths today, bringing the county total to 453. Those include a male in his 60s, a female in her 80s, and a male in his 80s, all with unknown health conditions, and our sympathies go out to their families. For those that have completed the IDPH required 10-day isolation period, we are at 27,173. For state totals, they've tested 18,315,522, with positive test results of 1,191,520. That's an increase of 2,104 since yesterday. Unfortunately, the state did announce 44 additional COVID-related deaths, bringing the statewide death total to 20,626. For hospitalization numbers in St. Clair County, we have 43 patients admitted due to COVID-related illness, and 2 of those patients are on ventilators. Regionally, there are 73 patients admitted due to COVID-related illness, and 3 of the patients are on ventilators. For our congregate living facilities, currently or previously in outbreak status, we will only announce the changes today. Knollwood Retirement of Caseyville has 17 cases and 1 death. That is an increase of 1 case for that facility. Mercy Rehab and Care Center in Swansea has 130 cases and 18 deaths, and that's an increase of 1 case for that facility. And St. Paul's Home in Belleville has 176 cases and 30 deaths, and that is an increase of 1 death at that facility. As we talk about every day, testing is still so vitally important. The most accessible testing site we have is at St. Clair Square. It's our state-run test site, open 7 days a week, 8 to 4. There's also various Walgreens, CVS, MedExpress pharmacies, and other testing sites that are also still available. So please make sure you get tested, know what your status is, so if you're around anyone, you're not asymptomatically transmitting this virus. Chairman?
Thank you, Brian. Nice job. Appreciate your work always. Thank you. Let's look at the zip codes for today. In 62204, we've got 1 new COVID positive, moving the number up to 384. 62206 up 2 to 1265. 62207 up 2 to 577. 62208 up 1 to 1578. 62221 up 9 to 2,712. 62223 up 3 to 1698. 62226 up 6 to 3109. 62232 up 4 to 877. 62243 up 2 to 749. 62254 up 1 to 788. 62257 up 1 to 339. 62258 up 5 to 1021. 62269 up 5 to 3176. And 62289 up 1 to 48. Everything's up today. 53 new positives out of 935 tested brings our county positivity up to 5.7%. Rolling average then goes up to 6%, and the regional positivity is also up to 4%. And that's derived by Bond County being at 1.2, Clinton 1.4, Madison 5.4, Monroe comes in at 0 today, Randolph at 2.9%, St. Clair 4.6%, and Washington 4.2%. So Herbert's Day 355 today. We've come a heck of a long way, but we're not there yet. And I think we need to encourage people that we just got to continue to do all the things that we've been told to do, recommended to do. Wash your hands, watch the social distance, wear your mask. And we just do this for a couple months longer or 1 month longer, everyone's getting vaccinated, and I think we're going to really see these numbers drilled down to a point where we can get everything reopened like the way it was and get back to normal. But as we see, people are still getting COVID out there. It's still being spread in the community with these new strains that have come about. It's making it more difficult for us to eradicate this virus, but if we just stick together, continue to do the things that we've been doing all along, we'll be able to end this live feed.
Well, and that's our goal. That's been our goal since 355 days ago, and we thought it was only going to be a week or so, and it has just moved every week since then. But, you know, the concerning part is in the last 2 days, we've had 7 deaths in St. Clair County, and when you look at the age of them, there were some 50s and 60s, and so as you said, the virus is still out there. You know, 53 new cases since yesterday. So,
and they're talking now about the long haul, that there are going to be a significant number of people who have contracted this virus and have recovered, but will have permanent long-term effects from the virus. So it isn't just the trick of let's stay alive and let's, you know, the real trick is to not get this virus at all. Don't get sick. Get this vaccine in your arm, and then we can all move on with our lives without having these long-term effects, which right now, nobody really knows how serious they're going to be or how long-lasting they're going to be. We just know they're going to be there.
well, and the one thing we know is Team St. Clair has been in this since day one, and they'll continue to help spread the word. And we came this far together, and please hold in there with us a little bit longer. You know, the vaccination site was closed down today. Then Wednesday is the day we kind of take and do the house cleaning, getting the potholes straightened out because of the amount of vehicles that we're putting on there on a daily basis. So they've been there all day. As we said yesterday, we're going to be adding another lane here shortly. We're waiting for the health department, Mila, to let us know when that's going to kick off. We got some more staffing coming in. Of course, it all depends on the vaccine. I know she was on 2 calls this morning with IDPH trying to get a little bit more handle on the next shipment of that vaccine so we can do some more scheduling. So for those of you who've been ringing the phones all day today, when the call center representatives are telling you that, you know, be patient, they can't schedule those appointments without knowing the amount of vaccine that we've got in the county. So once we get that notification, that information will be out there, and then you'll be able to go in and schedule your appointment. And if you haven't signed up to date, we've got 102,100 citizens that have showed interest. As we say every day, doesn't mean you're going to be 102,000 on that list. A lot of people have already been vaccinated off of that list, but you have to start by signing up on the availability, showing your interest on our page here on the EMA site, on the health department site, or on the counties. That's how you get started in the process. And then once the vaccine arrives, then you'll be notified to go in and schedule your appointment. You know, with the new Johnson & Johnson coming out, the Moderna is kind of scarce right now.
And we were on the phone with the state today. We hope to get a notification on vaccine coming up very soon. So we're working. We know we've got a lot of second doses of Pfizer that are out there. Hospitals are taking care of the Moderna second dose from the fairgrounds, but they have a lot of second doses to give. So the state is aware of our need, and we're hoping that we'll be able to have good news.
And it's worth mentioning again that if you're at the time period of your second dose, it's okay to go out a few weeks past that. It doesn't mean you have to have it right there on that 21st day or the 28th day. You know, they're saying, 6 weeks, Brian, that you can go past that. You just can't get it before that time frame. So we know everybody's anxious. We know everybody's concerned. But if it's going to be a couple weeks past your second dose notification, that's okay. Once we get it in, you'll be notified, and then we'll get you in and get it taken care of. We'll be back with Cindy to translate this into our Spanish communities, and then we'll be back tomorrow for day 356. Everybody have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this deadly virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.